Hello dear patients, let's talk about the 10 rules that you cannot have after having a BBL surgery. Rule number 1. Do not lie on your Botox, especially for the first 2 to 3 weeks. Also, the first week is really crucial. When you have a BBL surgery, you made a kind of tissue transplantation. You take your fat cells from some place and you put it to another space, and they have to survive. That's why we don't want any pressure on the fat cells. You cannot lie on your Botox, but you can sleep on your abdomen, or you can lie on your back with the help of a kind of like BBL pillow. We don't want any pressure on the Botox. We don't want to kill our fat cells. We need them to survive as much as they can. Rule number 2. Do not have any kind of extra pressure on the garments. We don't want heavy pressure on the garments because you have a surgery, you have liposuction on the abdomen, and we don't want to squeeze the skin too much. If there is too much pressure on the skin, maybe you can have some skin necrosis or skin healing problems. That's why we don't want aggressive pressure on the skin. To avoid that pressure, we usually use some kind of like lipofoams that helps to reduce the pressure. But the first important thing is the choose of the corset or the garment for the first stage, to reduce the pressure, reduce the swelling, but not too much. There is a limit. Rule number 3, don't start an immediate diet because you're in the healing phase and you need more calories than usual. And also we have some transferred fat cells and they need calories as well. So you need to feed the fat. I don't mean that you eat everything, of course, you eat healthy, but you have to take enough calories to supply the fat cells what you have. Rule number 4, don't skip to check your garment's position. It's also very crucial. Usually you just put the corset on and you don't take care of the corset in daily life. When you lie on the bed, when you get out of the bed, you need to be sure that the corset is flat and perfectly straight. If you have any pressure zone, or if any kind of dressing is rolling on itself and it's making just 1 point pressure, it can cause a kind of skin necrosis or skin irregularities or extra swelling on that zone. So you have to check very often your corset, make it straight, make it flat. This is going to help about the recovery process a lot. Rule number 5, you cannot lay around. You cannot lay on the bed all day. You have to keep moving. You have to be active. Because when you have a surgery, the circulation in the extremities is usually low, and to prevent from thrombosis, we of course give you some blood thinners, but extra you need to move your legs and foot, and you need to be walking around. It's going to help you about the swelling, it's going to prevent from thrombosis, it's going to help you to have a better recovery. Rule number 6, you cannot smoke. Smoking prevents the blood circulation on the skin and it's not good for healing in all types of surgeries. So you cannot smoke, just to prevent the fat cells from dying and just to prevent your skin from any kind of extra circulation problems. Rule number 7, do not skip to check your drains. After your surgery, probably you're going to have some drains in the front and in the back, and they help the skin to get rid of the extra liquid, extra lymphatic liquid. Because drains makes negative pressure, it sucks, it works between the tissues and it sucks the extra liquid inside. And if it doesn't work properly, it means the liquid is going to stay inside. It can cause a kind of seroma or extra healing problems. That's why you have to not to forget to check your drains very often. If you have any problems with the drains, you have to inform your surgeon. Rule number 8, maybe one of the most important rules in this list. It's not to forget to book your manual lymphatic massages. A manual lymphatic massage therapist is very crucial after your surgery. It's very crucial after your recovery, because when you finish your surgery, you have the liposuction and you had many extra lymphatic liquids and you have maybe potential fibrotic problems about your skins. That's why the professional help is going to be really important for your recovery period. It's going to fasten your recovery. It's going to give you like more smooth areas after liposuction and to prevent from the fibrosis. And also, if it just avoids the pressure of extra liquid inside, and it prevents you, it helps you a lot about not to having a seroma. So don't forget to book your manual lymphatic massages immediately after your surgery. It can start in the first day after surgery, or it can start like maybe when the drains are out, but you need to visit your therapist at least 2 or 3 times per week. It's going to be really helpful about your recovery process, and you're going to recognize after the massages all time the lymphatic system will work more faster and will take more from your swelling, and you're going to be more faster to have the recovery. Rule number 9, no solarium, no sunbathing. You have to avoid from the sun, at least for the 6 to maybe 9 months, because after liposuction your skin is going to be really sensitive, especially in the healing phase. The skin is going to be really sensitive for the sun and ultraviolet lights. So if you're going to have a holiday, you cannot have sunscreen. You have to use sunscreen creams and protect the skin from the ultraviolet lights, because it can cause extra pigmentation, extra color changes on your skin. So you have to avoid to have sun or a solarium. Rule number 10, do not forget to use your second stage garment, because in the first healing phase we don't want too much pressure on the skin. Yes, that's why we use more loose corsets, more elastic ones. But when the liquid is over, when the healing phase is like recovering more and more, your skin is going to maybe need a little bit of more pressure. Second stage garments is used to also used to shape the abdomen plus to shape the buttocks, because it gives a firm image. It also helps the skin to redrape in the right position, and it doesn't let the skin to be like more loose and more droopy. So you can start your second stage garment like 2 or 3 weeks after your surgery, and you can use them like for 3 to 4 months, or maybe for 6 or 9 months. It's going to be really helpful for your recovery and for your final shape. Thanks for watching. See you in the next video.